Hello, welcome, namaste, suswagatam, jai hind. Welcome again to our special edition of Expert Talk live show, and today is episode number 124. So, tonight we have the honor to welcome our distinguished guest, Dr. Vivek Kumar Pathak, one of the most respected ENT specialists in Greater Noida. Our topic for tonight's discussion is uh, uh, understanding hearing loss, causes, symptoms, and treatment options. And hearing loss is a prevalent issue that affects millions of people worldwide, yet it is often misunderstood and overlooked. So we will discuss the crucial aspects of the this topic. So let us welcome our guest of the day.
Good evening, Vipul, and very good evening, everybody. Today is a very important topic which is relevant to the society as a whole. So, hearing loss we are dealing with. What are the various aspects of hearing loss? What is the etiology? What are the various treatments which are available? How to prevent hearing loss? That will be discussed.
Yes, welcome on the show, Dr. Vivek, and thank you once again for accepting our invitation. So, audience, I'm your host for the day, Vipul M. Mali, founder of Post Resume HR Consultancy. So, we do provide recruitment services across India and Africa since last more than 16 years, and uh, particularly for mid to senior level management positions in IT, engineering, manufacturing, pharmaceuticals, and textile industries. Additionally, we also offer assistance to job seekers through resume writing, LinkedIn profile optimization, and career coaching. We believe that sharing is caring, and purpose of this expert talk show is to bring in the industry experts like Dr. Vivek Kumar Pathak has joined us today to share their real life experience, knowledge, and insights with all of us, which will help us in our personal and professional life. So do check Dr. Vivek's profile. You can follow him. You can connect with him for any help, any guidance. He'll be happy to help you. And do subscribe our YouTube channel, Vipul the Wonderful, and press the bell icon to get the regular live updates. And Dr. Vivek Kumar Pathak, a well respected figure and one of the most well respected ENT surgeon in Greater Noida. Dr. Vivek Kumar Pathak has several decades of specific experience under his belt, and he has over 10 years experience in this field. The uh, clinician treats and manages a wide range of conditions such as nasal polyps, radiation necrosis in neck, and hyperthyroidism and goiter. Some of the common conditions treated by ENT surgeon Dr. Vivek Kumar Pathak uh, are hearing loss, tonsillitis, and nasal polyps, and the cochlear implant, which help bypass the damaged ear and also stimulates the auditory nerve. And uh, we encourage you to actively participate in this session. You can ask your questions. We'll be happy to help. We'll be happy to answer them during the live session. So do type in your live questions in the chat box, and we will be happy to cover them in the live session. So without further ado, let's give a warm welcome to Dr. Vivek Kumar Pathak once again, and let's start the session. So before we start the session, please tell us something more about you and your life journey till now. Dr. Vivek Kumar Pathak, over to you.
So, Vipul, I am a ENT surgeon, or you can say ENT specialist, working in Noida and Greater Noida area. Uh, I have almost 14 years of teaching experience, both clinical side and in the teaching also. In medical students, I teach also. So typically, I have seen a lot of patients, and a lot of patients come with the hearing loss. Actually, now we are seeing that patients are coming in the younger age group. So typically, we have to know what are the factors which are causing these, and we some are very avoidable causes. These causes can be with general awareness we can avoid them. So I typically work in some corporate hospitals here. I have a clinic in Sector 20 in Noida, and typically my routine goes by seeing patients doing surgeries related to ENT. Uh, as you know, ENT comprises of ear, nose, and throat. So the basic surgeries we perform are tympanoplasty for nasal polyps, the FAS. And regarding my background, I have done my MBBS from Assam Medical College, then my MS in ENT. So my MS was in 2013. After that, I associated with medical college and doing my practice here in Noida and Greater Noida area.
So that's amazing. So to begin with, the very first question: what are the most common causes of hearing loss?
So first of all, I will start with that. As you know, there are five hearing. There are five senses, and these senses are typically the God has given them to enjoy the life. Eyes, whether it is eyes for the vision, so is our ear. Ear is for hearing. The tongue is for taste. The skin for touch. So whenever we are having these senses intact, we can enjoy our life. But once they are gone, the quality of life it hampers. And typically in day-to-day activities, we cannot enjoy the life as full as a healthy individual. Okay. So regarding the etiology or the causes of hearing loss, the causes are different in the different age group. If we start with the womb, when the fetus is inside the womb only, so it is called as prenatal, before the birth. So the causes are genetical. It can be syndromic or non-syndromic. The most common infections that we encounter is called as TORCH syndrome, cytomegalovirus, or the rubella virus infection. Certain causes are inside the mother, so that can be contracted by the fetus. Then there are perinatal, which are during the pregnancy and after the pregnancy. So some drugs that the mother has taken, there are certain autotoxic medications that they are absolutely contraindicated. They can cause autotoxicity. So if the mother is taking those drugs, it can cause hearing loss or damage to the cochlea or the hearing organ. Then birth asphyxia. If the child is having the delivery was a difficult one, and the child has birth asphyxia, then also there can be damage inside the cochlear hair cells. Then we come in the infancy and the childhood. So the most common causes in that age group, it can be because of congenital cause that has manifested in the childhood, or it can be a trauma, or it can be because of wax. In case of adults, it is most commonly the wax inside the ear, or it can be chronic suppurative otitis media, or CSOM, or in uh, simple language, infection inside the middle ear. In case of elderly age group, if the patient is typically from 60 to 70 years, that is called as presbycusis, and the cause is age-related hearing loss. In working class, it can be noise induced hearing loss, or occupational induced hearing loss can be found.
Yeah. So uh, that's amazing. You have explained it very well, and so how one can or one can early symptoms of how can early symptoms of hearing loss can be identified, as you rightly said, what are the symptoms of hearing loss, but how can I identify this loss in very early stage?
So WHO has a paper has been released on 2nd February 2024. The burden which is at at around 2050, almost 2.5 billion people are supposed to have hearing loss if we are exposed to loud noise. Okay, so how to identify it? Number one, uh, if patient is having known cause, so known risk factors are there. Suppose a patient is working in an environment which is continuously exposed to loud noise above 70 to 80 decibels, and that is continuous for 7 to 8 hours. Then this noise or the loud sound causes damage to the cochlea. So if you can see, this is the cochlea. You can say this is the cochlea. This is the hearing organ. Okay, it has outer hair cells and the inner hair cells. Because of noise, these hair cells can damage. Or certain types of medications. There are a group of medications that we call as orthotoxic medications. If the patient is taking these medications, there is a history. of taking these medications, then there can be we can elicit the patient can have hearing loss. Or if there is a history of ear discharge, patient is having chronic ear discharge, and patient developing hearing loss. So these are the very obvious causes that we can figure out. If the patient is an elderly age group, and typically the patient has to increase the volume of the TV to hear the news or any program that the patient is typically is watches inside the TV, or the relatives are saying that he is having hard of hearing and he has to raise the voice. Okay, that is the first sign that the patient is developing hearing loss. And certain types of diseases are particularly found in certain sex, like in females in pregnancy there can be hearing loss, that is called as autosclerosis. So from the history we can take out whether the patient is developing hearing loss, then we can go for investigations.
So what are the latest advancements in the treatment of hearing loss?
So first of all, I will start with with the first step, that is that we can do. Okay, certain things we can do before the development of hearing loss. So that is called as screening. Okay, so worldwide there is, in India also, in we have a program, that is we go for screening of the hearing loss. So if the child is born, we can ascertain whether the child is having normal hearing or not. A basic investigation can be done, that is called as autoacoustic emission. If the child is born, within 24 hours, just do the autoacoustic emission. We can ascertain whether the child is having hearing loss or not. But it is a screening test. Again, we have to repeat the test when the baby is discharged. Again, if the patient, if the test is negative, then we have to go for another test, that is called as Bera scan. And if it is negative, then obviously the child is having hearing loss. So regarding recent advances which are available at present, so starting with the hearing aids. So hearing aids, now there are battery of hearing aids are there, and lot of advancement has occurred in these hearing aids. They can be very precise one, so that cosmetic reasons, some people they don't put the hearing aid because of cosmesis, because of aesthetic reasons. But nowadays, very small CIC hearing aids are there which can be used. If the patient is a candidate for hearing cochlear implant, then it is the best to do a cochlear implant as early as possible. If a child has been diagnosed with hearing loss, which is a cochlear type, then we have to we have to counsel the parents that the child can be a candidate for hearing aid, also a cochlear implant. And the recent one is the called as brain stem implants. In those individuals which are not a candidate for cochlear implant, because their cochlea is completely damaged and some part of the nerve is also damaged, in that case we can go for brain stem implants also.
Okay, so you have explained about these cochlear implants. So can you explain how cochlear implants work and who can benefit from them?
It is a very good question. So first of all, I will explain what is cochlea. Okay, so the ear is divided into three parts: external ear, middle ear, inner ear. So cochlea, the main hearing organ is called as cochlea. Okay, it is like a 2.75 ton. It is a tube which is turned into 2.75 tons. It has outer hair cell, inner hair cell. Then there is nerve which carries the impulse towards the brain in the cerebral cortex, that is the hearing area. Okay, so this curved tube 2.75 tube is called as cochlea. Okay, it has hair cells. Now we have to, if the uh, child is having hearing loss, which is diagnosed at the time of birth or within 1 month of the birth, we have to look for whether the nerve is intact or not. For that, we do a scan that is called as Bera scan. Other battery of tests are done. If the nerve is intact, the cochlea is somewhat, the cells are damaged, we can go for cochlear implant. So it is a type of implant, you can say. How it works? So it has an assembly. Okay, it has an outer assembly. Then there is an electrode, battery of electrodes which we put inside the cochlea. So it is a surgical procedure. Okay.
Okay, so the next question is, what is the typical recovery process like for a tonsillectomy?
So tonsillectomy surgery, nowadays we typically go by the latest technique, which is the coagulation tonsillectomy. With coagulation, there is less bleeding because the most concerning part in tonsillectomy is bleeding. So you have to control the bleeding. That is the dictum for tonsillectomy. So nowadays we use coagulation. With coagulator, we can just co- uh, we can dissect the tonsil and we can coagulate the bleeding vessels. So recovery time with this technique is typically, you can say, 4 to 5 days, but sometimes the recovery can be fast also.
Okay. And the follow-up question is, how do conditions like nasal polyps and radiation necrosis affect the hearing?
So nasal polyposis is nowadays we are seeing a lot of cases of nasal polyposis because of you can say exposure to the you can say allergens, dust particles which are present in the atmosphere. So they cause in polypodal tissues inside the nasal cavity. So polyp is a multiple feet. It is a Latin word. So it is prolapsed nasal mucosa. Okay, inside the nasal cavity. Okay, now, what are the symptoms the patient will have? Because of polyp inside the nasal cavity, there will be stuffiness inside the nose, unilateral or bilateral nasal obstruction, discharge from the nasal cavity, facial puffiness, facial pain, sometimes periorbital pain also. So, what are the treatment options available? So, treatment options are, either we can go for medical management or we can go for surgical management. So we have to go by the scan. Actually, CT scan will guide us. Okay, the symptoms will guide us and the scan will guide us. If the patient is having polyps which are present in so lot of sinuses are there inside the facial bones, frontal, maxillary, ethmoidal, sphenoidal. Okay, so depending upon the number of sinuses involved, either we can go for medical management or the surgical management. Surgical management is functional endoscopic sinus surgery, but before that we have to start with the medical management. Okay, so typically we give intranasal corticosteroids, antihistaminics typically, and then we can go for surgery.
Oh, well explained. So these all are, technical or something basic, very detailed explanation. Now moving on to a layman's language, what are the non-surgical treatments options available for hearing loss? If you can explain that.
Non-surgical options, number one is the hearing aid. Even if we are going for cochlear implants, we typically go for a trial of hearing aid. That is called as hearing aid trial. As you can see, I'm using a spec because my near vision uh, is not 6 by 6. So I have to make it 6 by 6. Putting a spec. Same is with the ear. If I have to if I have to hear optimally, my brain will perceive the impulse if both the sides of the ear are sending the impulse simultaneously inside the cerebral cortex, which is the hearing part in the temporal lobe. Okay, so typically hearing aid is an aid. It will aid in the hearing process. Okay, we have to keep in mind. So it will amplify the sound. Suppose I'm talking on, suppose, on 40 decibel. So the hearing aid will amplify it so that the patient will be hearing normal. Okay, suppose patient is having 50 decibel hearing loss. With hearing aid, it can come to the normal range.
So decibel is something, a technical jargon I can say, but as a layman, अगर मुझे अगर feel होता है कि what is a high noise for me, if I want to judge for myself, so what is the frequency, high frequency, or which is the non-dangerous, you can say non-harmful sound for me? How can I take a judgment of it?
So, Vipul, I will say that it depends upon two or three main criteria. Number one is the distance. From the distance, the noise, the sound is coming. Okay, what is the decibel of the sound? Decibel is the intensity of the sound. Okay, and third is the frequency of the sound. Okay, the most common, the most important parameter is the decibel of the sound. Okay, so anything above 70 to 80 decibel. Okay, from the near, it obviously it will cause more trauma as it is as from the far away place. Okay, so that's why we typically say that we advise nowadays that you don't have to put headphones or the earphones or the devices for a longer duration at high intensity. Keep them in low intensity. If you at all, you have to use them.
So well explained. And we also have one live question. Audience, you can definitely ask your questions. And like we have one question from Manish Gupta. He's asking that uh, can we use earbuds for cleaning our ears? Like generally, I've heard many times that ENT specialist doctors prescribes advise not to use earbuds. So what is your advice on that? Expert
So
opinion.
it is a very good question and very practical question. Number one, earbuds are not advisable and not recommended because of two causes. Typically, we use earbuds to so that our wax get we want to extract the wax from the ear, but it paradoxically it further pushes the wax laterally towards the tympanic membrane or the eardrum. Number one, and number two, our external aortic canal is not straight; it is a curved tube. Okay, if you use an earbud, it will cause trauma, micro trauma inside the skin of the external ear, and it can cause infection inside the middle inside the external ear. And we have seen a lot of patients which give history of using an earbud 2 or 3 days before, and then there is a complete swelling of the external ear and there is excruciating pain. So that is not recommended actually. So the dictum in case of day-to-day activities of the ear is keep the ear dry. Don't put anything inside the ear until unless it is indicated. So there are indications of putting inside anything inside the ear.
So you are saying that we should not use earbuds. Then, and you also advise that we should keep our ear dry, but which is not possible many a times. If we go for bath or during this rainy season, this is a rainy season. So how to keep it dry? And a follow-up question is what we should use or how we should keep our ear clean instead of earbuds. What we should use or how we can keep it clean.
First of all, ear has a self-cleansing activity. Their cilia are there inside the external aortic canal. Sometimes there is wax get impacted inside the external ear. In that case, we can go for uh, safe practices like we can go for suctioning. Okay, some cyanolytic ear drops can be used for few days so that the wax becomes softened. Then we can go for extraction of the wax through suctioning because that is the very safe procedure. And we can go for syringing also, but nowadays we typically according to safety the suctioning is recommended actually.
Okay, and do you recommend that we should like the for let's say if giving example of dental, so generally it is advised that we should go for teeth cleaning every once a year or once a 6 months or as prescribed, but we should go for it. So do you suggest that we should visit ENT specialist for ear checking regularly or ear cleaning rather than regularly? What is your recommendation on it?
So it is a very good question. So number one is development of disease and one is before the development of disease. Okay, so if you go for regular checkups, typically we go for screening. So that is advisable whenever you are having stuffiness inside the ear is getting itching sensation inside the ear. These are the common indications that you have to visit an ENT specialist. So regular checkup is advisable specifically in certain age groups. Suppose patient is having 60 to 70 age group. In that case, obviously, ear checkup is I must say it is recommended that you regularly you visit so that the disease doesn't develop. If it develop, we diagnose it very early.
Yeah, that's great. Thank you, Manish, for asking question, and thank you, Mahendra, for the appreciation. And we really appreciate your participation, active participation. And the next question is like, how does hyperthyroidism relate to ENT health?
First of all, you have to know what is the thyroid gland. Actually, thyroid is a gland. So they are endocrine glands inside the body, and they are exocrine glands. So thyroid is an endocrine gland. It has two lobes, right lobe, left lobe. Then there is a connecting tube, which is present above the trachea, anterior to the trachea. Okay. Now it secretes hormones. We all know that thyroid gland secretes hormone. That is the thyroxine hormone, T3, T4. Okay. Now, depending upon whether the T3, T4 increased or decreased, we termed it as hyperthyroidism or hypothyroidism. So if the T3 T4 is increased, the TSH level goes down. Okay, that is called as hyperthyroidism. And if the T3 T4 is low and TSH is high, then it is called as hypothyroidism. So hyperthyroidism typically is the diagnosis of clinical symptoms. So typically the patient of hyperthyroidism will present with significant weight loss. Okay, patient will have a weight loss. There will be increase in the frequency of stool. Okay, there will be cold sweats. A lot of sweating will be there and cold sweat, and so that they are the main symptoms. Then we can think about the patient will be having hyperthyroidism. Then we go for laboratory investigation, thyroid profile. Okay.
Well explained. So again, the question is, what preventive measures can people take to protect their hearing? uh, like nowadays we are hearing getting a lot of news in the media about the hearing loss by few of the celebrities at very young age. So what is your advice on that, and how one can prevent that?
So number one is avoidance of noise. Okay, noise exposure has to be avoided because hearing is our sensory organ. We have to preserve it at any cost. Okay, number one. Number two, you have to, if at all you are in an occupation that you have to use headphones, earphones for longer duration, just keep the volume at low possible intensity. And if you can use your phone at a distance from the speaker, then it will be good for your hearing. Number three, don't put anything inside the ear until unless it is indicated or it has been prescribed by your doctor. Don't put earbuds inside the ear; they cause more harm than they cause any benefit. Don't put any eardrop, whether if it is not recommended by any doctor. Because we have seen a lot of patients, they put antibiotic eardrops which is not indicated at all, but the patient is having just earache and he is putting in a eardrop. That is causing that will cause more harm than benefit.
Okay. uh, so now, last but not the least, can you share a success story of patient who significantly improved their hearing through your treatment?
A lot of patients were there, but typically I will just summarize it how my our motto is to give the hearing to the patient. That if we can give to the patient, that will be a boon to the to us also and to the patient also. So how to give it? First of all, you have to diagnose it. Sometimes patient doesn't come. Okay, they just with patient is having discharge from the ear, and he or she is not coming because he thinks that it will get improved. But it whenever the patient comes to the OPD, it is almost worsen the disease. Okay, so just we have to diagnose the disease very early. Okay, so that appropriate management can be done. Okay, so the success story, typically we do cochlear implant surgeries, and uh, whenever you give a hearing to any patient, then it is just you can say very you can say feel good factor for a doctor actually. Okay.
Like it's like giver's gain, giving happiness to someone by restoring his hearing. So that's a amazing feeling. And yes, Dr. Vivek, you are doing great job. Audience, you can check Dr. Vivek on social media. You can search at the rate Dr. Vivek Pathak, and you can follow him on Insta. You can follow him on LinkedIn, and he'll be happy to help you. So before we leave you, what is your final words? What is your final advice for our audience, Dr. Vivek?
So for my final advice, number one, you have to preserve your hearing. That is in your hand. Okay, all those practices which cause trauma to the hearing or trauma to the cochlea, that we have to avoid. Don't use anything just because to get relief or something. Just take an proper advice from the qualified doctor and follow him, follow his or her advice. Okay, then early diagnosis and early treatment, that is the dictum in anything inside the body. Okay, same is the with hearing loss also. If you are having hearing loss, come forward, get it diagnosed, so that appropriate treatment can be started. And regarding certain types of medications that you have to avoid, that is a list of medications that is called as autotoxic medication that has to be avoided.
So that's amazing. Great advice. Great piece of advice for our audience. And we thank you once again, Dr. Vivek Kumar Pathak, for joining us and sharing his real life experience with the audience. I'm sure this knowledge, this details will help many of our audience. And yes, audience, once again you can check Dr. Vivek Kumar Pathak's profile and you can follow him for any help, any guidance. And Dr. Vivek, hope to see you again on our Expert Talk show with a detailed discussion once again on this uh, topic. This is very crucial for anyone. So, thank you once again.
So people, you have taken a very good initiative. I think we have to uh, we have to um, aware we have to start with the awareness of the common conditions that we can raise the awareness uh, in the general public. And I think with these tips, I think patients will get a lot of benefit.
Thank, thank you so much. Thank you once again. And hope to see you soon. Stay blessed. Thank you once again.
Thank you.
Yeah.
Good night.
Yeah. Yes, audience, I'm sure you would have got a lot of insight from today's session. And बस ऐसे ही जुड़े रहिए हमसे. Hope to see you again next Friday with some different industry expert will come who will share their knowledge, experience, insights with you, and you can join us. You can ask your questions as well. And ऐसे ही जुड़े रहिए. Follow us on LinkedIn if you are watching from LinkedIn, and you can follow me there for the regular updates on HR trends and expert talks. And if you're watching it on YouTube, then subscribe our YouTube channel and press the bell icon to get the regular updates. So, audience, this session was powered by Post Resume. So, check our website and do connect with us for any help, any guidance, any support. We will be happy to help you. And this was our 124th episode, signing off for the day.